Well, good morning, everyone, and welcome to Health Talk. I'm Peter Christian. John King is right over there at his accustomed place. Good morning, Mr. King.
Good morning, Peter.
Busily getting all your Facebook stuff ready to go. We have a lovely guest in the studio, and it's not John. Susan Nelson is joining us. She's Director of Community Care and Prevention Center at Community Medical Center. Welcome. How are you?
I'm well, thank you.
Good to have you on the show today.
Thanks. Always good to be here.
Tell us a little bit about you and about the place that you work.
Well, I have been at Community Medical Center for 16 years. I'm the director of the cancer program there. I have a bachelor's in nursing and a master's in administration, and I would say that this is the best job that I've ever had.
Now, why do you say that?
I would say that it's the best job just because of the people that we take care of. It's really nice to have a family and a patient and get to know them and see them frequently and really just establish those relationships. So,
you know, when you think of a cancer center, there are so many different kinds of cancer. Okay, it just seems like at the top of the news almost every day there's a different type of cancer that is being focused on. So you primarily want to deal with women today, is that correct?
Yeah, we have a new oncologist that came this month, Dr. Siobhan Lynch, and we have added that female oncology component to our existing program.
Okay, so in what way does this expand your program?
Well, women, and I think CMC has always been known for its women's services, and oftentimes women choose to have women as their providers.
Sure.
And so by adding a female medical oncologist, we now have an entire group of people that are taking care of the cancer patients that are female. Dr. Michelle Proper has always been here. She is the radiation oncologist from the Billings Clinic. Dr. Elizabeth Sue runs our high-risk breast program and is a general surgeon that does breast cancer. And Dr. Siobhan Lynch now is the medical oncology component of that.
What is medical oncology? I mean, we use the word oncology lots of different times. They all sound like medical jobs to me. So what's the difference?
They do sound the same. Medical oncology really does the medical side, the medication side, so the chemotherapy, those types of things. And then the radiation oncologist, also medical, does the radiation oncologist does the radiation component of cancer treatment.
So it's kind of like a two-track system. You're either going to the radiation side or the chemo side.
Sometimes both.
Sometimes both.
Or
Double
surgery
duty.
too. So
okay.
yeah, so all those different modalities, which Community Medical Center has every single modality that is available for treating here in Missoula. We can treat the radiation side and the medical side. So we treat all different kinds of cancers.
And what is your job behind the scenes in all this? Are you just picking the people and putting them in place and say, go, go, go?
Well, I participate in picking the people, but really the team picks the people. I interview folks and pass them on if I feel like they are the right person for the job. And then we do peer interviewing, and so the team really picks those people that are addition. I would say that we are super fortunate. When we started the program back in 2009, there are still most of the people that started that program still work in the cancer program today.
Wow.
And I think that just shows the environment that it is, and it's a great place to work. It's great teamwork, and I would say that everybody is there for the right reason.
Let me ask you, what are the reasons that people are there? Obviously, when you're a healthcare provider and you select cancer as the specialty you want to go into, does a lot of that delve from the fact that maybe their folks or somebody in their families had cancer and they really want to get into it, or is it just something about cancer itself that appeals to the healer in these folks?
I would say it's probably both. I think everybody has been touched by cancer in some shape or form in their lives, whether it's family or friends. And some people do choose that, but I think it's also, again, the relationships that you form with people, and really that you're there making a difference every day.
So if you wouldn't mind describing, Susan, when someone comes into your center for the first time, what is the procedure? How does that work?
Just to step back a little bit on that, we have a program with Nurse Navigation, who are really the contact people for a lot of the primary care doctors and specialty care physicians like endoscopy. And those people are oftentimes the first people that get the call. So we get a referral from a primary care physician or a surgeon, specialty physician, and they take that call, or they can just be a referral to the center. Their first appointment is typically with the first provider that they can get in to see. So oftentimes it's the three modalities. Again, it's surgery, medical oncology, and radiation oncology. So we try to get them in as quickly as we can to whichever provider is available. For those folks that live out of town, we really do a wonderful job at coordinating appointments. We have folks that drive up from Salmon as far north as Whitefish that come down, and it's a long distance to travel, whether even if you're 2 hours away. And so we try to coordinate all those appointments with the medical, radiation, and surgical group. And then they oftentimes get a lot of diagnostic testing that is done, and then their treatment plan is made out for them.
Is it possible, do you guys also do any telemedicine? Is that something that can be done? There's some things that can be done on the phone, or perhaps via video, or like FaceTime or whatever?
We don't do a lot of medical visits that way. We have a nurse practitioner who also happens to be a female, and she does a lot of our symptom management, which we call it. She spends a lot of time on the telephone with patients. She is one of the folks that they can call in, ask questions. She manages all of the oral chemotherapy, and she really does a fantastic job working those folks through, getting them through difficult times, whether it's symptoms, side effects from medication treatment, or sometimes just they need to ask questions, and she's a great person to have on the other end of the telephone.
Sure.
So when you go in, and the only primary care physician there at the time would be the chemo specialist, and they look you over and they're like, are they going to say, oh, you need to go to surgery, or are they all basically trained to break you out into the type of modality you need to go down?
They are not a specialty in that area, and I would say that our physicians work extremely well together. One of the nice things about the cancer program is that when we built the building, we've designed it so that we could have all those folks in one location, and that has been the vision, and now we are able to do that. We've got all the specialties in that building, but they will always defer to the specialist that is the primary for that. The way the cancer treatment goes, there are national guidelines called NCCN guidelines that basically lay out the most recent treatment that is available for patients, and those are the standard of care. And so those will break down, and every different kinds of cancer has a different component that needs treatment. And so they collaborate on all of those, and then they get back together. Every week we have a tumor board, and the physicians get together, all those specialty physicians, and then including radiologists and pathologists, and they just discuss all the new cases with the slides, the imaging, everything that goes along with it, along with other surgeons that are there for the tumor board.
So you get lots of eyeballs on each case.
We do. We get lots of eyeballs, which is a really great thing to know that so many people are looking at your case.
So it's definitely a collaborative effort.
Extremely.
There are no lone rangers out there, right?
There are no lone rangers. Even the independent physicians that we have on the campus, they are wonderful. They attend those tumor boards. Really great collaboration between all the specialists.
Even the Lone Ranger had contact.
We're going to take a quick break. 721-1290. If you have a question for Susan Nelson, Director of Community Care and Prevention Center at Community Medical Center, give us a call. 721-1290. Health Talk will continue right after this. Okay, we're back on Health Talk. 721-1290 is our number. 1-800-568-5309. Talking with Susan Nelson, Director of Community Care and Prevention Center at Community Medical Center. Let's talk some more about your newest acquisition, if you will. Evidently a great background and comes to Missoula with a lot of great experience, right?
She does. Dr. Siobhan Lynch is her name, and she did her residency at Columbia University and then her fellowship at MD Anderson in Texas. And she's been in private practice for about 3 years, specializing in breast and gynecologic cancers.
Okay, good deal.
And so what are these places?
MD
No contact. Well, that's great. That's a place.
MD Anderson is one of the primary cancer centers in the country. They rank right up there with Sloan Kettering in New York and Seattle. So she is very well trained. She actually was the chief fellow while she was at MD Anderson. So we feel extremely fortunate. And then with her background in breast and GYN, it really fits into well with our women's services at Community Medical Center. We also have the Billings Clinic gynecologic oncology surgeons that come to the campus. And so with her expertise in breast and GYN, it really makes a great package for those female patients.
So one of the top cancer centers in the country, and she was at the top of that. Mm-hmm. And then she comes to little old Missoula to smell the smoke. That's cool.
She does. She's loving it, and our patients love her.
Well, that's great. Though I was a little confused about what a community care and prevention center director does. So I mean, it sounds like you designed parks with organic raspberries or something.
Gosh. Well, we do have a healing garden.
What is the community care aspect?
Well, what we do is community cancer care and prevention, and what my job really is just to get barriers out of the way for the staff and the physicians. And so really it can be anywhere from the management side, budgeting side, patient care side. I do try to reach out to the patients. We call it rounding at the hospital, just to find out if they've had any, actually to find out what their care has been, first of all, to make sure that no matter where they go at community medical center, not just our center, but because they visit radiology and the laboratory and surgery and they're up on the floors as inpatients, making sure that those stays are the best that they can possibly be.
Gotcha.
And then if there's anything that they say to me that I need to follow up on, that's my job then to follow up on those things.
Now, there is tumult right now with half of Congress trying to get rid of the Affordable Care Act and half of Congress trying to save the Affordable Care Act. So when it comes to paying for these services, is it a state of flux, or is there a fixed way that you obviously help with those problems too, right?
Yes, I do. We actually have a reimbursement specialist who does all of our pre-authorizations with the insurance company. She works very closely with our social worker for folks that are uninsured or underinsured to make sure that we are reaching out for every possibility, trying to find financial support for those folks. Pharmaceutical companies oftentimes have discounts for patients that are not on a federal insurance. And so we really try to reach out to those places to find financial support. We rely greatly. The folks that were self-pay previously are now on the Affordable Care Act. And not only is it a great benefit for those patients, but it really takes away one of those stresses that they have when they were underinsured or uninsured, and it makes a huge impact for them overall.
What is the prevention aspect of your title? Because it sounds like most of the people that come to you have cancer already.
One of the great things about the program is that we're really looking at ways to prevent cancer as well. We've been on here before, and we talked about our Walk with the Doc program. Obesity is one of those factors that is huge, and it's a huge impact on developing cancer. There's 13 different kinds of cancers that are associated with obesity.
Wow.
And so we started a Walk with the Doc program on the prevention side. We're really trying to get early screening and diagnostics done through the lung cancer screening program. And getting people in for colonoscopies. One of the things that the state is doing with the colorectal roundtable is to have 80% of the people screened for colon cancer by 2018.
What are we at now?
Montana ranks about 48th in the United States for colon cancer screening. And it's one of those things that's preventable. So if we can get people in and have their colonoscopies done, or even the new testing, the Cologuard and the FIT, which are just fecal types of testing, not going in. Some people have an aversion to having a colonoscopy.
Yep.
Those things can test for.
There's one right there.
For blood or for DNA in the stool that then might indicate that they've got something going on. So we really are trying to get more into that as well, because we don't want to just treat cancer. We want to prevent people from having it, and that would be the best thing for us. So
with the goal of 8 out of 10, and we're 48th in the country, I mean, how much work is it to get? I mean, what's the average in Montana? Do we have any idea? Like how many?
I think we're about at 56% right now.
56%. And what age do you start counting? When do you need to have a colon, or should you get?
Well, it all depends on your family history. So that really is a factor in that. If you've had any problems in the past, if you just have normal screening, it's after age 50.
After age 50.
And I would say that our primary care physicians are that first point of contact for patients, and they are really trying to do the best thing because they really look at the quality for our patients, not just patients coming in, but their overall health and prevention. And so that really starts with our primary care physicians.
So after 50, should you get one every
10 years?
Every 10 years. So
unless you've got something going on. So if you're normal, and I shouldn't say normal, if nothing's there, that you don't have any polyps or anything removed, anything like that, it's every 10 years. If you have something that you needed to have removed, it can be anywhere from 3 years to 5 years, just depending on what they found.
All right. So let me ask you this. For someone who's never had one, like me, I've never had one.
Oh, shame on you.
No, I just, it's a conscious choice I've made.
Okay.
I've never had one. There's absolutely no history in my family at all. The only cancer that we had was through smoking. My mother and father both died of lung cancer from smoking, but never any problems with other stuff. So I just have not wanted to do it.
So but you don't know if you've got polyps or not. Unless you've got a big magnifying
nothing
glass
wrong
and
down there. Let's just say I've never had any problems with that area. So how do you speak to somebody like me? Okay. What do you say?
Well, family history is only one component
Okay.
of having cancer. And so we do have a genetic counselor that deals with all those genetic types of things that go on that cause cancer. But it can also be sporadic. So you may not have a family history at all, and you might be the one that ends up with colon cancer. You may not have symptoms for a very long period of time, and that's the whole reason for having a colonoscopy on a screening level. People typically don't have symptoms when they're just a polyp. And polyps are precancerous lesions. So you will never have symptoms. You won't have any bleeding or anything like that until you are at an advanced stage, and then we can't cure you anymore. Mm-hmm. So if you're at stage 1 or stage 2, we can cure a cancer. If you're at stage 3 or 4 with colon cancer, we can't cure you anymore. We can take care of you, and we can treat the cancer as it is, but it's not curable.
Yeah, in the last year, I had a friend my age, 30s, mid-30s, went in, had a bunch of polyps and stuff. They had to get checked, precancerous stuff, had to take care of it. Luckily, they could take care of it early. Mm-hmm. And, yeah. Anyway, real quick question from Gregan actually called in to ask, when it comes to the Cancer Center, you made talked a lot about how you have almost all female staff for female patients at the Cancer Center. He was curious, what is the breakout for the genders when it comes to cancer treatment? Is it about a 50-50, or do you see more women than men?
No, we see more men than women, actually.
More men than women?
Yep.
So in what way? You're talking about just colon cancer or all
types of cancer? That's a higher rate of men that we see than
do we just live more dangerously or what?
Well, apparently we don't get our colonoscopies.
No, there are different types of cancers that have, obviously that have higher risk for different things. But we see at the Cancer Center more men than women.
Gotcha. All right, we're up against another break, 721-1290. When we come back, we'll talk about the Relay for Life coming up. Yeah, right. We'll take care of that. We also have Mark on the line. We're going to get him on, and you'll have to put those headphones on, Doctor. We'll be right back with more in just a moment. Here we are back on Health Talk. 721-1290 is our number, and we have calls already for Susan Nelson. Let's get Mark on the line. Mark, you're on with Susan Nelson. Go ahead. What's your question?
Hello, Dr. Nelson. It's not really a question, it's a comment. And you said about the collaboration between the nurses, doctors, and staff. That's great because you're a community hospital. We used to have 2 community hospitals, St. Pat's and you guys, until St. Pat's got bought out by a hospital corporation. And they've been having problems between their staff and doctors. So I just want to thank you for staying local and staying community.
All right, thanks for the call. Now, you guys are affiliated with Billings Clinic as well, too, right?
Yeah, we are Regional Care Capella Health, and Billings Clinic is a part owner in Regional Care Capella Health as far as CMC goes.
Gotcha. Okay.
We had a question from Gregan, who actually asked the question about the male-female breakout when it comes to cancer treatment. But he was curious whether or not you see a lot of men with skin cancer because they go outside without wearing sunscreen.
We do, actually. The first stop for those folks is typically a dermatologist, and those folks are seen, and then that skin tissue is biopsied and it's sent to pathology. And if it is something that is significant, which would mean more than a millimeter deep, that's pretty much how they stage colon cancer and look at what needs to be done next. They oftentimes get referred to a head and neck surgeon for a sentinel node if it's up on the upper body, or to a general surgeon. And then if it's positive, then they come and see us. Yes, we do see an increase. We are one of the highest rates of melanoma in the country because of our outdoors. We
have about a minute and a half left in our show. So tell us about the Relay for Life. When and where? What's going on with that?
So as always, we partner with the American Cancer Society for Relay for Life. This is the second year that it'll be on the Community Medical Center campus. It is September 9th, and this year it runs from 4 until midnight. The walk starts at 4, and we have partnered with the Bitterroot, with all of Missoula County this year to try to have a larger Relay for Life. The Survivor Dinner, which I would invite everybody that has survived cancer to come to that. If you want information, please call us. The Survivor Dinner starts at 5, and then the Survivor Lap, and then the rest of the folks will join in after that.
It may surprise you to know this, but every year for the last 8 or 9 years, I have read the names for the Luminaria ceremony.
I recognize your voice.
Yeah, so I'm telling you, and I always put my mom and dad's name in there, and all our relatives who have either died or have had have been successful in their fight against cancer. So
absolutely. So it's those people that have passed away that you would like to recognize, and those people that are still fighting the fight, and those that have been cured.
Give us some contact information for your center and how we can get in touch with you and make an appointment or do whatever.
You can call us at 327-3911. You can like us on Facebook at Community Cancer Care, and we'd love to see you.
All right. It's been a pleasure getting to see you again.
Thank you.
Thank you.
Too.
All right. You guys have, we're going to take a quick break, come right back with open phones. Our telephone lines will be open at 721-1290, and we will be back with Talk Back in just a few minutes.